Hi, good afternoon, everyone, and welcome to today's CPD webinar, QI in Practice Using Clinical Audit Tools to Increase Influenza Vaccination Uptake. My name is Chelsea. I'm the Digital Health Officer at Central and Eastern Sydney PHN. Today, I am joined by Kalen, CESPN's Immunisation Officer. Kalen will be speaking throughout this presentation also. Central and Eastern Sydney PHN acknowledges the Aboriginal and Torres Strait Islander people of the nation. We acknowledge the traditional custodians and sovereign people of the land across which we work. We recognise their continuing connection to land, water and community and pay respects to elders past, present and emerging. I'd also like to extend that respect to any Aboriginal colleagues joining us here today. Just some housekeeping. Please note that the webinar will be recorded and will be available on the CESPN YouTube channel within the next couple of days. If you can, please all turn your audio off and put yourselves to mute. That would be great. And if you have any questions, please submit them into the Q&A function at the bottom of your screen. We will address all questions throughout and at the end of the presentation. At the end of the webinar, an evaluation survey will pop up on your screens and a post-training survey will also be emailed to you. Before we get into the immunisations quality improvement activities, I just wanted to let everyone know about some of the programmes we're currently offering here at CESPN. Provider Connect Australia, PCA, is a newly introduced initiative. It's a no-cost service operated by the Australian Digital Health Agency. The purpose of it is to facilitate the accurate updating of business information. It automates the distribution of updated information to business partners and focuses on streamlining the maintenance of healthcare organisation and practitioner information. Partners include nominated hospitals, pathology, radiology services, public service directories, secure messaging providers, and more. Health and Community Service Directory. So CESPN has launched the CESPN Health and Community Service Directory, designed to help people in the Central and Eastern Sydney region better understand the programs, services and groups that are available to people within the community. Lists a range of organisations that provide health and social support services in the CESPN region with an emphasis on public services that are subsidised or free to the public. So it's kind of like a Yellow Pages, but for health services, groups, programmes within our region. It's also a really good resource, not only for health professionals, but for patients to also look up. The Telehealth Psychiatry Service provides free consultations with psychiatrists to people who are living with severe and complex mental illness in the Central and Eastern Sydney region, who due to social, economic barriers and other social determinants would not otherwise be able to access private psychiatrists. Working in collaboration with GPs and other mental health and psychosocial support set providers, the key aspects of this initiative are to provide telehealth psychiatry services and to engage with GPs supporting people accessing the service to facilitate capacity building and support ongoing patient treatment plans. Consultations will be offered to consumers via secure video conferencing, either from their own or a support person's home or from their service provider or GP's office. So the digital health team. So everyone in our region is assigned a digital health officer. We are here to support you with all things digital health. The digital health and QI team supports general practices, aged care, allied health and specialists in areas included but not limited to PIPQI, Polar, My Health Record, PIPQI, Lumos, secure messaging, electronic prescriptions, telehealth and My Medicare. The immunisation team, the aim of the immunisation team is to reduce the incidence of vaccine preventable diseases in the community by providing appropriate and timely information to immunisation providers and the community and promote the delivery of the National Immunisation Programme. The team provides a range of immunisation information and resources, which you can see on our webpage. This can include assisting with childhood immunisation overdue reports, how to navigate the Australian Immunisation Register and Australian Immunisation Handbook. Advice in the event of a cold chain breach or a power outage, data logger support and training. Even for just general questions, we can direct you to where would be the most suitable place to go or whomever to contact. So the importance of quality improvement. The activities we'll be running through today are all part of the quality improvement in general practice. Quality improvement is foundational to contemporary high-performing primary care. It can improve uptake of evidence-based practices for better patient outcomes, better professional development, and better systems performance. PIPQI. So practices are required to do at least one quality improvement activity per quarter to meet the requirements of receiving PIPQI payments. The activity can be the same one done over a few quarters if the topic is a big area of focus, or you can do a new one each quarter. It doesn't need to be a huge activity. It can be something simple, such as data cleansing, i.e. making sure your allergy status is recorded for all patients. Simple activities can be run by non-clinical staff members and clinical QIA, such as recalling patients for tests. These should be run by clinical staff.
Hello. Hi, I'm Kalen from the immunisation team here at CESPIN. I'm also joined by my colleagues Mimi and Kira as well, who will be helping out with answering any questions that may come through on the chat in relation to immunisation. So I'm here to give you a bit of background around influenza immunisation for this particular quality improvement activity. So we can see here in this table from NCEARS, we've got a breakdown of how New South Wales as a state compares to the rest of Australia in terms of influenza vaccination coverage at the moment, and which is also broken down by age groups. So overall, we are doing okay in comparison to the rest of Australia. There is definitely room for improvement, not only as a state, but as a country on a whole. We can see here for New South Wales, especially for our higher age band, so those who are over 65 years, we are definitely a little bit lagging behind Australia, the average immunisation coverage for Australia. And we all know that this is an at-risk group for worse outcomes as well. To give a bit more specific context, here we can see the immunisation rates for our CESPIN region compared to national statistics for patients over 65 years, those diagnosed with diabetes, and those with COPD. So these three measures also happen to be three of the PIPQI quality improvement measures that we will go into a little bit of more detail in the next slides. So on a whole, we are a bit behind compared to the rest of Australia for these subpopulations in our CESPIN region. We can see that the general trend over the past couple of years is that since COVID, influenza has somewhat fallen off the radar. However, it doesn't mean that it is any less important. And this is where you guys, as primary care and general practice, can have quite a big role to play in this and protecting our community against influenza. So in the next slide, we'll compare these subpopulations for an example practice compared to the CESPIN region in relation to your practice progress reports. So here we have an example of data from a practice progress report. So if you're a practice that is signed up to PIPQI incentives, you should be receiving quarterly practice progress reports, which includes a lot of useful statistics for your practice, including how your practice is tracking for influenza immunisation. So if you aren't already receiving this, you can contact the digital health team and they can help you get set up for this. So these reports are quite a helpful resource to understand where your practice is sitting in comparison to the rest of the CESPIN region. So specifically, quality improvement measures or QIMs, so 456, look at influenza vaccination for over 65 years, those with diabetes, and patients diagnosed with COPD, respectively. So these are some of our high-risk population groups that we should be focusing on in getting immunized each year with the influenza vaccination. And this is also why it is a measure that the Department of Health is specifically wanting to keep track of and why they're included in your reports. So, sorry, I just accidentally switched. Switch to the maps. So we can see here for this example practice, they have done great to immunize all their COPD patients to 100% for QIM6 in comparison to the 51% national average. However, if we look to the left-hand side for immunizations in 65 years and above, it's not doing as well. So this is just an example of how to kind of read these reports. However, it should also be kept in mind that the data can also be affected by a number of things. For example, are you inputting the immunization data actively into the correct fields in your clinical software or populating the air records regularly? So, for example, also for the COPD example, it jumps up quite significantly to 100%, which may just be due to only having a few COPD patients at your clinic. So any kind of change in whether that patient has been immunized or not will seem quite significant. So it will jump up quite in a big percentage. Also, influenza statistics often naturally dip at the end and start of the year outside of influenza season. So if these numbers you are seeing don't seem right, it's a great opportunity to speak to your digital health officer and they can discuss with you and also understand what might be the cause and how you can improve it if there is a certain error that's coming up. So the question is, how do we improve influenza immunization rates for everyone? So to start off with, we have a dedicated influenza page for immunizations on the CESPIN influenza webpage. And this contains a lot of helpful resources for influenza that we try to update quite regularly. And this also includes the New South Wales Health Flu Toolkit. So this toolkit is released each year, which provides a good summary of everything you need to know about influenza and immunizations. Ideally, this document should be read before flu season starts, so you can actually prepare your practice for the season, and it gives you an overview of the timeline to prepare for various things, such as when orders will come in, when is the best time to start ordering paper resources and that kind of thing. Generally, all the frequently answered questions are in the toolkit, such as what brands are available, eligibility requirements, how to order vaccines, and other resources. Just as a side note, we've had a couple of questions come in about how to order more influenza vaccinations, as most practices would have received their first allotment of influenza vaccinations. And so to answer that, you will need to actively click in the portal to order subsequent orders. So there's a button that says click place influenza order 2024 in order to receive more stock. And this is just what the inside of the toolkit looks like. So it includes like the different brands and eligibility on the NIP as well as age range. So how do we encourage our patients? So right now we are living in a new context of vaccinations in a post-COVID world. And over the past couple of years, we've had a lot of bombardment of constant vaccine talk, mixed messaging and fears. And it has definitely led to a lot of vaccine fatigue in our communities. So people don't want to get vaccinated unless they see the actual benefit of it. So we know that influenza is something that we see every year and it won't be going away anytime soon, and it isn't any less important. So therefore, we need to be reminding patients what are the benefits of vaccinating, and also being quite mindful of our language and conversations and relationships that we build with our patients. So this means that the conversations that we're having with your patients should be tailored per person. So listen to their situation. So your patients may be living with infants or grandma and grandpa, Therefore, they're in close contact with vulnerable people. And you can emphasize how it will protect not only them, but also reduce the risk of hospitalizations. As another example, if your patient is quite a busy person, you may want to frame it in a different way, saying, hey, it reduces your risk of having to take time off of work or put your kids in daycare. Most importantly, listen. So ask them what their concerns are, what are their barriers, and from that you can sort of tailor that conversation and find a way to kind of encourage influenza vaccine uptake. Also, I think sometimes we also underestimate the power of saying, I would recommend. So often we know that having a flu shot each year is recommended and it's a good thing to do. But as the healthcare provider, as a doctor, you are their trusted, sort of like a trusted caretaker. And so saying, instead of saying, this is recommended, say, I would recommend. So just kind of place that extra emphasis on the trust between that relationship. Also look at opportunistic vaccinations. So if they're already there for something else, you can always follow up with, hey, have you had your influenza shot this year? You can just try your luck and see who is interested in getting it done, whether it's in the clinic or directing them to a nearby pharmacy to get that done. Also focusing on NIP eligible patients. So these are your low-hanging fruit because the vaccination is subsidized and free for them. So these are your over 65 years, 6 months to 5 year olds, pregnant women, Aboriginal and Torres Strait Islander peoples. So this is all outlined on page 8 of the New South Wales Health Toolkit. And the toolkit also includes information on how to order posters and resources in a resource order form. And also, this is an opportunity to be creative as well. So you can ask your staff to start their own specific flu campaign. So maybe if you have nursing students or medical students who are there on placement, they can take this up as a particular health promotion project where they maybe focus on a particular population and create resources and focus on those patients who are coming into your practice. And another great way to encourage patients is also through recalls, so SMS and email recalls, and also identifying your NIP eligible patients using the data extraction tools, which Chelsea will demonstrate in a few slides' time. So you can create these reports and recall these specific patients who would benefit from a flu shot. So the data extraction tools that I'm referring to are CAT4 or Polar. So practices in the CESPIN catchment who participate in PIPQI will either have one of these two data extraction tools, and these tools are quite helpful to allow practices to view and analyze their current practice data. The PHN also uses the de-identified data to create your quarterly practice progress reports. So you can speak to your DHO about getting one of these tools set up for your practice.
Okay, so the how-to. Let's open up. So I'm hoping you can see the PenCS CAT4 screen. We will go through Polar after this one as well, but I just wanted to say that, yeah, what we're going to look at now, we're going to look at patients that are 65 years and over who were not immunised against influenza. We're going to look at the proportion of regular patients with diabetes who were not immunised against influenza, the proportion of regular patients with COPD who were not immunised against influenza. And please note that the demonstrations that I will be giving now on Pen and Polar are both dummy practices. So for those of you using Pen, when you log in, this will be generally be your front screen. So we need to pull up some data. So over on the left-hand side, we've got the show extracts here. I'm going to click on the top one, which is the only one I have, which is de-identified data. But for yourselves, you'll probably have a whole list here. And what I would suggest doing is using the most recent data set to look at those patients. So to give us a bit more screen visuality, I'm just going to close this extract box. And as you can see, for our dummy practice here, we've got 12,000 patients. What we're now going to look at is the filter section. It hasn't loaded yet. So sometimes when the screens are grey, it just means that the data hasn't loaded properly yet. So we'll just give that another couple of minutes. Okay, and there we go. So for the first one, we're going to look at your patients that are over 65. Come on. Under the age range here, I'm going to pop 65. Now, anything that you change up here in your filter section, you will need to hit recalculate. Come on. It's always the way, isn't it? We might come back to PenCat. We'll get that one, leave that one to load. So we'll jump into Polar, which I hope you can all see that screen now. So I'm going to go into the report. So what you will do is click on Clinic Summary for your practice. And this will also take a moment to load, depending on the size of your practice, will depend on how quickly that will load up. Okay, so for our dummy practice here, we've got 77,500 patients recorded. What we're going to do is we're going to tick the little box over here on the right. So we're going to look at our RACGP and active patients. So we're looking for patients that have come to the practice 3 or more times in the last 2 years. And that has reduced our number quite significantly to 11,000 now. Now, to go to the part that we need, we're going to click over here under clinical and then clinical indicators. And over here, we've got our inclusion filters and our exclusion filters. So what we're trying to identify are patients that are 65 years and older who have not had the flu vaccine. So let me move. So under our age band here, I will click on 65 and drag the mouse down to hover everyone else. And that again has changed our number. Now we are going to go to the exclusion filters. And we're going to exclude that immunisation because we want to find patients that haven't had the immunisation. So across here, we'll go over to immunisation. Under immunisation group, I'm going to type flu vaccines. And I'm going to say within the last 15 months, as per the RACGP guidelines. And now we have our final list of patients that are 65 years and older who have not had the flu vaccine. And for Polar, now we've got our patient count. To grab the list of who those patients are, we're going to double click on that number and it will produce the list for you. If you wish to export that to Excel, you can do by clicking the button up here. And that will open up an Excel spreadsheet for you. Now, to go back to the previous screen, Over on the right-hand side, I'm going to click back to clinical indicators. And what we've selected will be across the little sub-tabs here. So we've got our patient status active, our RACGP active, and I'm going to remove the rest, because we will now look at those with diabetes. So as you can see, the patient count's gone back to our RACGP active. We've still got that selected. We are now going to go under diagnoses in our inclusion filter, because we want to include those patients that have diabetes. Oh, let's go chronic disease here and select all patients within our practice that have diabetes. So it's identified that we've got 848 patients. And now we're going to go to the exclusion tab again. We're going to go flu vaccine in there to group them up. And again, we're going to say in the last 15 months. And there you have it. So you've got for our dummy practice, we've got 440 patients that are diabetic and have not had the flu vaccine yet. Double click on that number and it will produce the list for you. Again, click on this button here, which will export that to Excel, and you can create your reminders and so on from that. So just as we did before, I'm going to go back to clinical indicators. And I might leave most of these on here, but what I'm going to do is I'm going to take off the chronic disease for diabetes. And the next one we're going to add is COPD, which again is part of the PIPQI quality improvement measures. So I'm going to click on diagnoses. I think it's still thinking. Yep, there we go. Under SNOMED, we're going to type COPD. And there we have it. We've got 78 patients who are active. They've been 3 or more times in the past 2 years, who have not had the flu vaccine. So if we go over to the exclusion filter, it would already have that in from the previous quality improvement when that we done, like so. And then again, we double click the number, it will produce the patient list. We export to Excel.
Sorry, excuse me, Chelsea. I just wanted to, we're going to have a couple of questions on how to make the list alphabetical order.
Oh, okay. So the best way to do that is to put that into Excel and then filter it alphabetically from Excel, not from Polar. I hope that answers your question. Okay, so that's Polar. I know that might be a bit confusing for some people. If it is, you know, your DHO officer is always here to help you. So please give them a call and they'll be able to run through all of this again. Okay, let's see if PenCat is working.
Sorry, Chelsea, as well. I just wanted to ask one more question that we had. Was that the fact that a lot of flu vaccines wouldn't be captured within practices because they might have got their vaccines elsewhere?
Yeah.
So I guess, you know, it would be about using that Excel sheet that is downloaded, and then you'd have to go into each patient file and download their updated immunization history from AIR to ensure that they have not, in fact, had that vaccine.
Yeah.
And then you'd probably have to run a report again after doing that.
Yeah, correct. Unfortunately, both Penn and Polar don't communicate with AIR or pharmacies. There's no cross data pathways there. But yeah, unfortunately, yeah, patients do go and get them done elsewhere. And yeah, unfortunately, Pen and Polar will not know that. Okay, so I'm hoping you guys can see the PenCat view now. So we're going to look at all three quims again, but using Pen. So we started off by putting our age range in here. And like we did in Polar, under activity, I'm going to select our active patients and those that have come 3 or more times in the last 2 years. Now, anytime you change anything within this filter section, over here you have the red recalculate button. At the moment, we've got 12,000 patients. By hitting recalculate, we now have 1,900 patients that are 65 years and older who have come 3 or more times in the last 2 years. I'm going to push this filter back up so that we can see more of the screen there. But with PenCat, if we go all the way across to immunisations, the subheading is already being clicked on, so influenza. And this one is really lovely to see. So you can see here that there's 199 patients with nothing recorded. You can pull that out and export that. Actually, we forgot to put the timeline on it. Let me just go back. Apologies for that. Using your filter, if we go to date range, we are going to say the 15 months as per the RACGP guidelines, and I'm going to hit recalculate again. Make that smaller. Okay, so now this is our accurate, this will be our accurate data for this year. So of our 1,900 patients that are 65 and over, it's identified that there are 603 patients with nothing recorded. If you prefer to view that in percentage, you can tick the box here. And you can see that equates to 31.4%. If you want to view these patients, we're going to pull this part of the pie chart out. And over on the right here, we're going to click on export. And this will produce your report similarly to Polar. And then again, to export that to Excel, you can just click on the file and save that. So that's our 65 and over who have not had. Let's go back now, and we are going to look for our patients. So we're going to take off the start age. I'm going to hit recalculate. And now I'm going to look for our patients that have diabetes. So under the conditions tab, I'm going to select yes to having diabetes. It's already got our 15 months of not having a previous vaccine. And I'm going to hit recalculate. And because we're already in the immunisation tab, this will be a nice, easy one to look for. So of our patients with diabetes, we can see that we've got 34.8% with nothing recorded for this year. Pop that pie chart out, click on export, and that will produce a list for you with patient names. We're using a dummy server, so the names won't appear. Okay, what we're going to look for now will be our patients with COPD. So under our filters tab, we're going to go to our conditions tab. I'm going to untick diabetes, and I'm going to move over here to under respiratory, we've got COPD. And then I'm going to hit recalculate. And what we can see here is we've got a total of 117 active patients within our practice with COPD, and 35% of those have no flu vaccine recorded. If we untick the percentage, so that's 41 of 117 patients with nothing recorded. And like before, if we want to grab that list of who these patients are to try and get them in, we'll pop that out and click on export again, and it will produce our list. So that's how we do things in PenCat. Just a reminder that anytime you do change anything in the filter section, please always hit recalculate. And then for the different types of graphs and things like that, so for your immunization tab, it's just along here on the right. Click on that and it will always default to influenza. So that's the how-to, but I do appreciate that that was probably a bit fast. So yeah, if you guys do need a hand in running those reports, please do let your digital health officers know. So once you've generated your lists there, on our website, we do have the quality improvement activity templates available for you guys to use. So this is a great way to monitor and record your quality improvement activity. So this is the quality improvement activity. We have a number of them stored on our website. I might actually show you that now. We can quickly go through one. Where is I hope you guys can see the quality improvement activity planning sheet. So being at the practice, what you would do is put the name of your practice there. These are all editable PDF documents. We have tried to pre-populate as much of the fields as possible so you don't have to. Obviously, some wording works better for some practices than others, so you do have the capacity to remove and delete things as you wish. So we've generated our list today, so I'm going to put today's date. And the name of the quality improvement activity is to improve the recording of patients 65 plus and immunized against who's not immunized against influenza. So I'm going to put my name, and I suppose if I was at a practice, it'd be the nurses and GPs also. So the goal is to improve the recording of RACGP active patients aged 65 plus and immunized against influenza 2. So let's say that we had 40% who have not been immunized against influenza so far. We're going to try and up that. So we're going to say we want 80% of our patients immunized against influenza, and we're going to do that within the next 3 months. So the measure would be to compare the number of active patients aged 65 plus and immunized against influenza from today's date using pen or Polar. So if we are using Polar today, we would remove pen. The initial benchmark, so the practice benchmark report, which you guys receive quarterly, identified 60%. We're done here. Identified 60% active patients aged 65 plus immunized against influenza. Now, in the ideas section, here's where you get a little bit creative. You could even have a meeting with your staff. What things are you going to put in place or do to hit your new target of 80%? What are you going to do to get people in and get vaccinated? So these are our suggestions. I do appreciate that some or none of these will work for your practice. So you can delete and create your new ideas there. Once you've come up with at least 4 or 5 ideas, we move down into page 2, and this is our plan now. What are you actually going to do? So you might even use some of your ideas here. So for instance, the first one, identify active patients over 65. So we're going to do that. Then who's going to do that? Well, I've just run the list, and we've done that today. what's the next thing you're going to do? You might say, okay, let's create a flu campaign or some posters and put them around the waiting area. You would pop all that in there. So your plan, how you're going to actually achieve this target, and who is going to be doing each one of these points, and when are they going to be done by? Once you've started working on all these activities and you're trying to get all your influenza patients in, or patients that are eligible for a flu vaccine, then once you've done that, once the 3 months have passed, then we can come back in and answer the next 3 questions. Did we do it? What did we learn? And are there any next steps? These are really good for keeping hold of for your accreditation as well. Quality improvement is not just, you know, for receiving the PIP payment. It is part of our working group now. Yep. Okay, so I'm sure you guys probably are across it already, but you can use your clinical information system to set up reminders and recalls. I understand, I believe as well, if you're using HotDoc, a Health Engine or other third-party software, you can also set up your recalls and reminders on there as well. The good thing with PenCat and Polar is they both offer a prompting service. So for PenCat, you can use Top Bar, which sits across the top of your bar. So if a patient does come in who hasn't had the flu vaccine, it will flag up that they haven't, and perhaps you could, you know, try and book them in for that whilst they're sitting with you. And Polar uses something called Walrus. So if any of you would love that installed or are using it already, great. But yeah, just let your digital health officer know. And yeah, we can get both of those installed for you. So to set up recalls and reminders within MD, you'll need to click on the Tools tab on the toolbar at the top, select Options, and then select the Recall tab. Find the influenza vaccination and follow the prompts. And within best practice, on the toolbar at the top, you can select Setup Configuration, then the Reminders tab, select the flu vaccination, and follow the prompts. If you need any further assistance with that, then yeah, please let me know.
So, on a completely separate note, so if you're good with your influenza quality improvement activity and wanted to try a different different immunization quality improvement activity, the assessment immunization team have created a relatively comprehensive quality improvement workbook, which steps you through how to improve the rates of NIP childhood vaccinations for your patients under 5 years. So each month, the PHN can actually send you a practice-specific report which identifies which patients are overdue for their scheduled immunizations. So if you're not receiving this report, you can actually register on this link here at the bottom, or you can click to our immunization webpage, and there is a link for that as well. So the workbook contains instructions and scenarios on how to help you address your overdue children. So this includes common AIR issues such as merging duplicate files, data transmission errors, how to flag patients who have moved overseas so you can remove them from your report, as well as email templates to notify carers for an overdue child. So this is what some of the pages from the inside of the book looks like. It is a really great opportunity to look at your reports and take a look at this workbook in conjunction, as we have seen, and there has been a number of common infectious diseases on the rise recently, such as measles and pertussis. So this is quite a topical quality improvement activity that you can also work on. Okay. So these are our contact details for the digital health team and the immunization team as well as the general number for CESPIN, and they will direct you to whichever team is relevant. All right, we have a bit of time for questions, I believe.
Yes, if anyone's got any questions. Let's have a look.
I'll just jump in with that previous question about the flu vaccines given at other practices, I guess it's important that a step in the recall system would be once you've downloaded that Excel file and you've got the list of patients that you want to recall, you'd have to go into each patient's individual immunisation tab and click the download from air button just to ensure that they haven't had that vaccine elsewhere. That will improve your data for your QIMs as well. So that's how we'd overcome that issue.
Yeah. Anyone else?
I think the other questions have been
Answered.
okay. Right, I think that's it for today.
Yeah, that's probably it. Please do get in touch with your digital health officer and speak to the immunisations team. We are here to help you guys, and especially with the PIPQI and what's reported. Yeah, just
Sorry, there is a question here. Just going back to the recall for best practice, how is that set up? Is it set up to send a text reminder to the patient about their flu vaccination?
yeah, I think you can actually, it can be email, text. I think you have to select, and I don't know if there's a charge involved with text messages, but that's something that your digital health officer can help you with. Okay, guys, I think we might leave that there if there's no more questions. Thank you for your time today. I appreciate you would be really busy on a Monday morning. Oh, how do I download Walrus? Very simply, I can hopefully show you that. Let's see if that works. Here is my poll. Okay. When you're in Polar, when you first initially log in, over here on the left, it will say download Walrus. You click on install. It might not work for me because I don't have the a clinical system, but over here, click on that pop-up. And then you just click install. It takes 2 minutes. But if you're not comfortable doing it yourself, then your digital health officer can either log on remotely and help you or come out and visit you. And that's done. So the password to log into Walrus will be your same password that you use to log into Polar, and it will sit there. So every time you look up a patient within your clinical information system, it will pull up the details of what's missing for this patient and potential MBS items that can be done with that patient. But yeah, please do contact your DHO, and then they'll be able to give you an in-depth training session and download that all for you. Okay then, guys, we might leave that there. Thank you so much for your time, and yeah, we look forward to hearing from you.